Professor Keith, I mean, you did a really nice job of explaining the enhancements to the Affordable Care Act under the American Rescue Plan. And there is a big blinking light in front of Congress right now that it's time limited. In terms of trying to understand this issue better, I reached out to my good friend locally, who's an insurance broker, lifelong Republican, but who was enthusiastic about the ACA in terms of enrolling her clients. She told me a story that she had a couple who in 2020 were uninsured. Their annual joint income was about $70,000, which put them just above the 400% federal poverty level. So the private market did not offer them anything that was of any value or they could possibly afford. We passed the American Rescue Plan. The husband had been laid off, so that brought the premium down to the maximum, benefit, which was about $7 a month. And it's a good thing they had it because sadly, both husband and wife were stricken with COVID. The husband lingered in hospital for a long time, was on ventilators, and sadly passed away. And it's a horrific, tragic story, but there is no question that if we had not passed the American Rescue Plan, his widow would be looking at hundreds of thousands of dollars in terms of medical bills. Jen, the broker, told me another story about a dairy farm in our district, again, who in the private health insurance market was looking at about $30,000 for family coverage. With the enhancements, they were able to bring that down to about $50 a month. Again, the margins which the dairy farms operate on, as many of you know, is wafer thin. So they qualified for this assistance. I mean, it's hard to imagine letting those enhancements lapse. And I just wonder if the O'Neill Center has looked at really what the damage that would occur if that were to ever happen.
Thank you so much for that question. I would emphasize, I think, what the American Rescue Plan did is sort of get rid of that subsidy cliff above 400. It's not a free giveaway by any stretch. What it says is that no one should be paying more than 8.5% of their entire income towards premiums. So I think it's a huge protection, including for middle income people. And to your point, the biggest benefits have flowed to older middle income people living in rural areas, which is where premiums were the highest before the rescue plan set in. So in terms of the impact, if these subsidies are allowed to expire, people would see premium shock this fall for coverage next year. So many folks who are paying, as I mentioned, a third of healthcare.gov consumers are paying $10 or less for their coverage. They would see those premiums increase. You would have many of those middle income folks who have been able to, purchase coverage for the first time. And there is data that shows that more middle income people came into the marketplace over time as a result of the subsidy. So the impact has been huge. I'm deeply concerned that those impacts, could be undone if these subsidies aren't extended without more lead time for folks to understand.
And I mean, the evidence is all around us. I don't care what district you're from. In your testimony or in your written testimony, Professor, you talked about the fact that a public option, which would help with cost issues, could also be extended to employer-based plans. That, in fact, you could allow employer buy-in, which would, I think a lot of particularly small employers would be incredibly attractive. It would help stabilize, what is the largest component of our healthcare coverage system. By the way, I want to thank Professor Reich for helping us when we got rid of the Cadillac tax a couple of years ago. Your outspoken support for that actually, I think, protected a lot of employer-based plans. But again, Professor Keith, maybe you could just sort of talk about whether or not you could design a public option that would benefit small employers.
Yeah, absolutely. There's a whole range of sort of design decisions that would need to be made around a public option. I think one key one is exactly what you touched on. Would you want a public option to be limited to the individual market, available to small employers, or even extended up into the large group market? There's also questions about whether to allow employers to buy in or even let employees on their own buy in. I think all of those would have different implications that need a lot more study and analysis. But I would emphasize, I think, extending some kind of a public option that does in fact lower costs to the group market is going to have the biggest impact for federal savings, for employers, and for families in terms of really bringing costs down.
Great, thank you.